Next, we will move on to item 10C, which is a discussion and possible action regarding updates from city departments on the COVID-19 pandemic. Mr. Sayer, if you could get us started.
Thank you. So this item is going to take some time. So in the audience, and you guys can't see them, is pretty much every department head. And what we're going to do is kind of go around, in essence, the room or around the virtual room. And each department head is going to provide an update to the council on what their department is doing related to COVID-19 and kind of give you a high level overview of what they've been doing. The intent is they're going to shoot for about that 5-minute range on their update. And then once they're done, if you have any questions for them, I would ask them right away, because once they're done talking, I'm going to demote them back into the audience, and it's just a slight effort to bring them back in. So I guess I'll just kind of kick things off. I'm going to take a few different departments here and just give you a brief overview. From the administration side, obviously, we've been working on many policies to address the COVID-19 issue. Two of those significant policies are on the agenda later tonight. We have, in essence, frozen most of our hiring at this point. And the concerns being that, especially with our part-time staff, if we struggle to find work for them in the future, we may have some options available in other departments if that need arises in the future. So part of the challenge too is some of these hirings, our staff is, we're not fully staffing buildings right now. It's a skeleton crew in some cases. Some of those buildings are just, they're in essence closed or not available, and we don't want to bring somebody else into a building if there's no seat for them during the COVID-19 outbreak. On the administration side, we had a lot of people helping with the election on this side. I think a few alders have brought up before. The finance department helped, planning department, and they did a great job assisting with that. And then finally, City Hall, at least on the administration side, is closed to the public. The lobby and the area to the police department remains open, but the administrative side is closed. So if people are paying their any bills, they're encouraged to drop those in the drop box in the parking lots. Finance department, there really weren't many updates. Once again, staff has been helping from finance with the elections. Bills still have to be paid, so they'll still be coming in for relatively the near future to make sure bills are being paid. We are encouraging flexible hours across the board and trying to reduce staff coming in, but finance, obviously, we have to make sure people are getting paid with payroll and the bills. So we'll continue to work with them. From a building inspection standpoint, inspections continue. That's classified as an essential service by the governor. So their inspections continue. They are splitting their time between City Hall and working from home. They are available still by phone or by email. So if someone does have an inspection, they're still making those, but they're not holding as regular office hours as they normally would. And obviously, if people stop in to pick up a permit or to drop one off, they need to make those remote arrangements with the inspector versus trying to stop in at City Hall because the doors are locked. And then finally, planning. Once again, Catherine helped with the election. Development interest, I'd say, is probably slowing. Developers are very cautious right now. They're kind of in a wait and see pattern of how long does this go is the question that I think a lot of developers are asking of. Is it a short kind of span here, or are we still talking about this in 2 or 3 months? So, like I said, development interest, it's still there, but everyone's gotten really cautious and really slow and methodical in what they're doing. So more to come on that, I think, in the coming weeks when we hopefully here slowly start pulling out of this pandemic. So those are the updates I have for those kind of departments. Any questions for me before we turn it off to the next person?
Any questions for Mr. Sayer? Seeing none, okay. Whoever's up next.
Next is going to be Ellen.
Hi, everybody. So I guess what we've done primarily for COVID is surrounded the election, of course. So we had help, as Adam mentioned, from everyone here in administration, from finance to Catherine in planning to Kayla has been like I've told a couple other people, she's been like an Energizer bunny, really keeping things together and getting those ballots out and back and processed. in terms of COVID specifically in elections, we our extended hours for early voting were eliminated, and in-person absentee voting was limited to by appointment only. That worked out pretty well, actually. Excuse me. Sneeze guards were built by Simon and his crew, and they were like nothing I saw anywhere else on the clerk's list. They were just perfect. Masks and gloves were supplied for our election workers. Some brought their own, and which was fine. We had large bottles of sanitizing solution supplied by the Elections Commission, and the registration and check-in stations were sanitized after every couple of voters, as well as the voting booths sanitized after every 1 or 2 voters. Simon marked 6-foot intervals on the floors at both polling places for social distancing purposes, and that went pretty well for the most part. Once in a while, people were on top of each other, but mostly just crossing paths. We also had 10 National Guard members assigned to Verona for the election, and that was fantastic, just fantastic. They took over most of the sanitizing duties and monitored social distancing as best they could, helped inserting all the thousands of absentee ballots into the tabulator, helped with curbside voting. They were just incredibly helpful. We also had city employees working on election day, several from the library, some people here from administration as well. So that was wonderful. Getting the ballots out, and again, Kayla was pretty much in charge of that, though they, finance and, excuse me, Catherine and planning and everyone were working very hard with that. It was really like a well-oiled machine, so it worked out very well. In terms of numbers for the election, we had after today's canvass, the final numbers were 5,170 total voters, and of those, 4,370 of them voted absentee. I think that's all I have.
Any questions for Clerk Clark? Alder Journey.
So how did this year's numbers compare with the previous years?
The last presidential preference and spring election was in 2016, of course. And the numbers here are about 200 voters fewer than they were in 2016.
Thank you.
Any other questions for Clerk Clark? Seeing none. Thank you. And whoever is next, Mr. Sayer.
All right, next up we have Stacy Burkhart, our library director. Let me just promote Stacy right now. Stacy, you there?
I'm here. Right.
All
Hello.
right, there we go.
Hi, everyone. Just a quick update you. The library has been closed to the public since March 16th. Library staff are working from home. Our youth services staff is offering several programs a week online using either Facebook Live or Zoom. And those include story times and programs for school-age children and teens. We also have some adult programs online that are on our calendar, and we're working on developing more. Our staff are available to answer questions from the public via phone, email, and social media. And we're also heavily promoting our online resources right now, such as Overdrive, where we have access to thousands of ebooks and audiobooks. We also have RB Digital, which offers over 3,000 magazines digitally. We also have Ancestry.com, which you can get you from home currently, which was not available from home before. And Transparent Languages. Those are probably the most popular ones. Staff are also doing a lot of online trainings and webinars from home, and several, as Ellen mentioned, several staff filled in as poll workers as well. All our library materials are automatically renewed until May 1st, and delivery of items between libraries was suspended back in mid-March. So, does anyone have any questions for me?
Any questions? Seeing none, thank you for the update.
Hey, Stacy.
Mr. Sayer?
Okay, next up we have Stephanie, our Senior Center Director. Let me find Stephanie. Uh-oh. Oh. Stephanie, can you hear us?
I can. Can you hear me?
We can.
Yes.
Oh, there we go. Get my videos. There we go. Hi, everybody.
Hello.
A quick update from the Senior Center. We've been closed since the 16th as well. All of our staff are working from home except for essential business that needs to take place, mainly Meals on Wheels, having bills paid, etc. To limit exposure, we are only offering Meals on Wheels once per week, but we're supplying food for a week's worth of food for participants. On average, we're serving about 18 to 20 people per week for Meals on Wheels. We are working with Badger Prairie Needs Network, Festival Foods, TNT Catering, Miller's, and Dane County Consolidated Foods to make that happen. And a couple of local businesses have actually donated food. So a thank you to Fifth Quarter, the Draft House, and Hollander Restaurant at Hilldale. Transit Solutions, our bus company, is still running and available Monday through Friday. They are helping with deliveries on Tuesday, which has been great. So it's myself and the bus driver delivering the Meals on Wheels. They're offering service trips for things like Walgreens and food pickup, and they have a maximum of 2 people on the bus at a time. And Transit Solutions is also a new service. They are shopping for people for their groceries and delivering to seniors free of charge. And that's across Dane County. And then our case management, they're serving about 150 people per week. They're making about 150 calls per week. So they're staying very busy. And our programs team is just finding new ways to connect with seniors via email, Facebook, YouTube, phone calls, etc. We're completing a lot of continuing education things and other webinars online as well.
Thank you for the update. Any questions from the council? Seeing none, thank you.
Thank you.
Stephanie.
Mr. Sayer?
So next up, we have Casey, our Recreation Director. Let me find Casey.
All right, here we go.
Hey.
Hello, everyone. So as far as the recreation department, we are in a big holding pattern. Clearly, our office has been closed since March 16th as well. And, you know, you don't want to say this, but it happening in late February, early March was a better time for the rec department, so to speak. But if it continues much longer, it's going to be much more difficult. So basically, our spring soccer program has been pushed back. We were scheduled to start actually today, and I've emailed out all our registrants and let them know that unfortunately we're not going to be starting on time. We're hoping to possibly start in May, but clearly that's probably up in the air right now and probably not looking good. We did have a couple of engineering classes that started in mid to late February. We held 2 classes at Sugar Creek, and then the COVID, the policy hit, so they've went virtual. So the engineering group is doing it virtual learning, basically. So that's been really good. So we really haven't had to refund anyone in that regard. When it comes to refunds, I've had a few requests for refunds. We had a babysitting class scheduled for March 28th. Clearly that got canceled. We have one in April. That's going to be canceled. So I've offered them all opportunities to take future classes. We have classes all the way through August. Again, hopefully we can get back to a semblance of some normalcy. So, then we have youth baseball and our summer programs and the beach. All of that is stuff that we're waiting on, basically, what we can do. Can we open up these things and slowly do those kind of things? So really we're in a holding pattern, and most likely we're going to have to be doing some mass refunds, at least for spring soccer. I'm hoping we can have youth baseball in the summer, but that is up in the air as well. So we're really hoping to get some guidance from public health and the governor here in the next couple of weeks, I guess.
Thank you. Any questions from the council? Alder Journey.
So I'm curious, as far as the beach is concerned, will you hold off setting that up until looks like it's going to be a go as far as swimming is concerned?
Yes, that's something that we will have to wait and hear from the governor and the health department and kind of where that goes. Clearly, the beach, when it's a hot day and it's really nice out in the middle of June or July, we could get upwards of 200-300 people. So the likelihood of us doing that in June and July, I believe, is slim. So what we would do is put signage up and call it closed until we get the green light to at least maybe open, and then it may be on a limited basis.
Other questions from the council? Seeing none, thank you. Mr. Sayer.
Thanks, Casey. So next up we have Dave Walker. Dave, you there?
I think so. Am I here?
Yes.
Okay. A lot of pop-ups, so I'm just hitting buttons here. But anyway, as far as Parks and Forestry, we've been at half staff for the last 3 weeks, rotating. So I got 2 guys in, 2 guys off. I've been going in as needed 2-3 days a week, mainly for a couple hours in the morning. Other than that, I've been working from home, getting emails, phone calls, texts at home. Shelters and playgrounds are closed. We have hooked the water up at all our shelters so that once we can open them, should be pretty quick and easy to do so. Parks are getting used fairly heavily, although we're trying to do what we can to discourage gatherings, like taped off the playgrounds. But there's a lot of people out walking, and our guys have been emptying a lot of trash cans. So at least people have something to do to get outside. So at least they still have that. Our workload's gotten a little lighter because obviously a lot of Casey's leagues are canceled. Adult softball's been pushed back. We would be doing soccer fields now, but we're not doing that. Little League so far has been pushed back to May 15th. I think it'll probably be a little later than that yet, although they haven't officially decided that yet. We are coming in the spring season, and like Casey said, it's really kind of a good time of year for us because we're sort of in that winter to spring transition. We've got all of our equipment switched over to spring now. We haven't had to mow yet, although that's coming quickly. I've talked to all of our mowing guys. I think in the next couple of weeks, we'll have to be out doing that. We have about 75 trees coming in, although we haven't seen them yet. They'll be here next week. So we're getting to push come to shove time. But I think, as far as with half staff, we've been doing pretty good so far. as we get into closer to the end of next week, we'll probably have to start getting into more of our regular workload. But at least I think my guys are pretty okay with that. So that's where we're at now. So hopefully we can stick to that plan moving forward.
Thank you. Any questions for Mr. Walker? Seeing none. Thank you very much for the update.
Yep, thanks.
Dave.
Mr. Sayer.
Okay, next up, we have Theron.
So everyone got me?
Yes.
In a second, we'll have you.
All right. You got my audio, I'm guessing.
We do. There you go.
There we go.
All right. Good evening, everyone. Hope everyone's doing well. This obviously is challenging. As you can see, I'm sitting in my office here. So public works staff, obviously we're an essential service. So the water's on, the sewer's flowing downhill, or we're pumping it. And street maintenance is obviously ongoing. We share an office with the Parks Department, Rec Department, of course, so we've been closed since the 16th, like other buildings. I'll break this up into operational changes that affect the public, and then operational changes that we've done internally. And then I'll give an overview of the capital improvement projects. I'm looking down because I got some notes here. The changes that affects the public, obviously the office is closed. The recycling center out back is open, except we're not taking e-waste, tire disposal, or oil at this time because those take interactions with staff due to the monetary transfers and costs for those. Curbside bulk pickup did get modified last week with coordination with waste management. So basically, if you needed to put a couch out or bulk curbside, anything that doesn't fit in your refuse container, there's 2 dumpsters down at the public works site that you can bring those items to. It was a risk that waste management was seeing with their drivers, touching all kinds of additional garbage, getting close to their face and such forth. So it just was not a good situation. So it has gone well with the dumpsters down here so far. We'll see how that transition trends. Operational changes internally. We're about 2/3 staff here, 1/3 home. That's more for the outside staff on the operational standpoint. It depends on what department, either utilities or public works, who's here or not, but all the essential services are functioning. Any office staff that has the capability to work remotely is. It depends on what my wife's schedule is, whether I'm here or not, or teaching the kids, which they just might learn a little bit extra math and not so much English by the time I'm done with them. Staff is working in small groups, meaning the outside staff. If they are working in groups, they're in their equipment, so they're segregated just by the type of work they're doing. Any meetings that office staff has or others with either consultants, other regulatory agencies are remote, just like this meeting. And then we have a workflow plan that we made that is used by me and my supervisors. If something happens, what's our backup plan? Meaning if somebody gets sick or if I have an operator that's down, what's my backup plan if we have a water main break? So there is no good time for this to occur anywhere, but with it not being the dead heat of winter and 2 feet of snow on the ground, this is fortunately, probably if this was going to happen, now would be the time where it doesn't affect us greatly. Capital improvement projects wise, regarding these are projects we are administering. So our rehab project, our chip seal, and the one you just awarded tonight for the RRFBs. I do not see any changes with those schedules at all. Luckily, we do not have a large road project that we're administering. There is obviously other projects that are being done by others that we have involvement with, such as Verona Area School District transportation improvements or development projects, but none of them have any major impacts on arterial streets for closures of such that we need to be concerned with if work needed to be completely 100% halted. That's kind of my overview. I can take any questions from anyone at this time.
Any questions for Mr. Jacobson? Alder Rieke.
I just wondered, in your list of things that you are not taking at the drop-off site, it was e-waste, tires, and what was the other thing?
The oil and oil filter recycling, Heather. The reason why we're not, there's no fee for that. It's just in the same bin as the tire disposal, and we fenced both of those off. So that's the only reason we're not taking that.
Okay, thanks.
Yep, and it's posted too on our doors. It's on the website. We have an A-frame traffic control, like that you'd see on a sidewalk closure, right by the entrance to the back that says what's available and what's not. So we've done the advertisement. So hopefully that was good enough.
Any further questions for Mr. Jacobson? Seeing none. Thank you very much for the update.
Yep.
Mr. Sayer?
Thanks, Theron.
Thank you. Have a good night, everyone.
You too.
Okay, next up is Chief Coughlin. You there? Yep. Waiting
Yes.
for your video. Do you have video, Bernie?
How's that?
Pretty good.
Good, yeah.
Excellent. All right. Thanks for giving me a few minutes. Just a quick explanation. We've taken a conservative, calculated, and reasonable approach and consciously avoided making any knee-jerk emotional decisions. So just going to provide you with a kind of a timeline layout of date and action taken, which is pretty consistent with what we do with a lot of incidents. January 30th, World Health Organization declared COVID-19. Can you hear me fine?
Mike seems a little like there's feedback or something.
Okay.
Oh, it's better.
Any better? Okay. March 6th, we suspended officers responding to EMS calls where the nature of the call was for a sick person, like flu-like symptoms or general illnesses, when immediate law enforcement intervention wasn't needed. March 12th, Governor Evers declared public health emergency. On March 14th, we suspended ride-alongs, department tours, fingerprinting, face-to-face response to minor calls that we could handle over the phone, and also suspended community engagement activities and certain EMS calls. March 17th, the emergency order prohibiting mass gatherings of 10 people or more. March 17th as well, we drafted the ordinance that you're going to take a look at shortly, seeking your approval relating to violations of law relating to health. It adopts state statute 252.25, which allows better enforcement action if necessary. And I'll say it's only if necessary. We've done everything we could, honestly, to avoid enforcement action, despite numerous complaints. I think we've only had one incident which resulted in enforcement, and that was an incident with repeated violations up at Redden Soccer Park of a larger gathering. March 18th, DA's office and Dane County Sheriff's Office requested limits to the amount of in-custody arrests when possible, and to consider instead ordering defendants to court in lieu of incarceration. On March 19th, Juvenile Reception Center also limited taking custody of juveniles that don't meet criteria of being, quote, substantial risk of physical harm to any person if not held in secure custody, end quote. March 20th, suspended all trainings, including in-service. We canceled our April, May in-service session. Our next scheduled in-service training.
I think we might have lost your audio again.
Okay, better?
Yes.
Okay. March 20th as well, we initiated pre-trip squad cleaning process where we just used a solution of water and bleach, where officers do pre and post-trip cleaning of their squads. March 20th, the Dane County Communications Center started asking questions of callers in an attempt to ascertain symptoms of people that EMS and law enforcement are responding to. March 23rd, we suspended the work of our limited term employees, our clerical employees, until further notice. If permanent clerical staff members were to become ill with COVID-19, LTE employees could be utilized as backups. On March 24th, we adjusted the schedule of one of our full-time clerical members and moved her to a Wednesday through Sunday to provide, to limit exposure during the week, and also to provide coverage for in-custody arrests over the weekend. That also then alleviated the need for us to pull in limited term employees to transcribe those reports on the weekend as well, limiting or reducing our exposure. March 24th, a safer at home order was issued effective 8 a.m. on the 25th. On the 26th, we developed return to work guidelines as it pertains to VPD employees who have been exposed or suspected to have been exposed to COVID-19. This included a symptom self-monitoring log. On the 31st of March, staff was directed to provide email complainants if they believe a business may be in violation of Emergency Order 12. They were referred to Public Health, Dane County, Madison. We also directed staff to track information pertaining to all calls for service related to the complaints of Emergency Order number 12. On April 1st, the city released Families First Coronavirus Act, and also then on April 1st, city released PD Emergency Responder Sick Leave Policy and FMLA policy addendum to the City of Rona's FMLA policy. April 1st as well, Safer at Home compliance document released by Public Health Madison and Dane County to give guidance on how to handle, where to refer business complainants regarding non-compliance issues. Later that day on the 1st as well, updated email address for people to file complaints to Dane County Madison Public Health. And also later that day on the 1st, we received minimal supply of personal protective equipment. And with that limited supply through Dane County Emergency Management, we were able to provide as many as 5 pulseless non-breather packs for the worst possible case if we had to deal with, and we only had to use 1 since. April 2nd, emergency order number 19 was released, relates to COVID-19 information by officials and the requirement for disclosure of COVID-19. The reason that was released is we were having debates among the various officials involved as to whether or not that information should remain confidential or not. And our first responders were of the opinion that it should be required to be released so we could protect ourselves as necessary. April 2nd, emergency order, April 2nd provided guidance on emergency order number 19 as it pertains to radio communications and response, as well as dispatched information. So that information, instead of being provided over the air audio, was actually provided through our mobile data computers to provide greater confidentiality for individuals that may have been impacted directly. Also on April 2nd, we reduced our shift briefing. We modified those so that fewer people had to be involved directly and could do more so electronically. April 3rd, changes made to suspend seeking search warrants for civil OWI arrest to obtain blood samples if the arrested person refuses to submit to a test of their breath. And then on April 8th, we started using a chlorine dioxide spray for cleaning our squads and gear. And that was as a recommendation from Patrick Anderson from EMS and also from Casey Dudley, which was much appreciated. So it's a general overview of the steps that we've taken thus far. If you have any questions or comments, let me know.
Any questions for Chief Coughlin? Alder Journey.
It sounds like you haven't had any exposures. The officers have had exposures to coronavirus.
We had one exposure or suspected exposure. However, the officer did not develop any symptoms. He did a self-isolation and monitoring, and everything turned out well for him, and he was allowed to return to work without missing any duty.
And then just out of curiosity, do you have access to testing?
We do now. That was delayed for quite a while, but we are moved from the second tier to the first. So the testing, I've been told that it's going to be faster now. And we did have one officer who had been out prior to the new policy being in place. So prior to April 1, he was out for actual suspected influenza A and B and strep throat, subsequently received the testing, which was negative prior to him returning to duty today.
Thank you. And then God forbid, but if a certain number of officers had to be quarantined, and that would put you at a critical mass of risk as far as staffing is concerned, are there any alternatives to cover the force, just in case there a number of officers would have to go out?
Yes, we've thought that through as well, and tried to prepare the best that we can for a continuity of services, at which time we would begin implementing a change of schedule, likely pursuing, right now our officers currently and historically have worked 6 on and 3 off rotation, which is an average of about 37.5 hours per week. And some agencies in Dane County and the state have gone to modified schedules in which some involve 6 on, 6 off, 12-hour shifts, or 4 on and 4 off, or a variety of 10-hour shifts as well. So in essence would be longer work days for people, but reduced possible exposure. So we have a few options that we have considered, and that would be our first start. And then secondly, we would assist others with moving supervisors to fill the road, working patrol, and subsequently also rely on a mutual aid from neighboring agencies if necessary as well. So.
Thank you.
Sure.
Other questions for Chief Coughlin? Seeing none, thank you for that update.
Thank you.
Mr. Sayer.
So next up, we have Dan Mahaka from the fire department. Dan, are you there?
I am.
There you go.
All right. So on the fire department side, we're still responding to calls, which is a good thing. Nothing changed that way, unfortunately, for us. We have to go on the calls. I would say that there's a little more nervousness with our employees going on calls because we get called out to the places where people might suspect they're having these issues. As far as the station is concerned, we have closed the station to public. We're trying to limit to as few people as we can. So that makes it just the duty crews most of the time. And then a couple chief level officers from both our organization and from Fitzrona being in-house at any point in time. So most of the time there's 6 to 8 people down here and that's it. We have also suspended all of our in-person training. We've moved that to online along with our meetings. We're able to accomplish that through Microsoft Teams and GoToMeeting, which has been nice and actually been working fairly well for us. As far as call volume has slowed a little bit, I would say, with it, but not too much. We're still having fires every now and again, car accidents every now and then, and so forth. We are definitely doing a lot more disinfecting and cleaning, trying to make sure that we keep our the workforce healthy here and public in general. I've also asked the crews to limit their time outside of the station, so any unneeded trips, or even trying to keep our training more back at the station when instead of going out in the public like we normally do. All of our fire inspections have been put on hold for now. We still are doing new building occupancy permits and so forth, so we still are getting some of that taken care of, but that has also slowed down a fair amount. I guess with that, if anybody has any questions.
Anyone have any questions? Alder Journey.
I'm going to ask the same questions I asked Chief Coughlin. Have you had any fire responders who have been exposed to coronavirus? And do you also have testing?
So with the state guideline, they're pretty much saying if you go outside, you're exposed to it. Any more than that, as far as like on calls and so forth, nothing that has been horrible so far yet. We do deal with cases, but if we're wearing our appropriate protective equipment, it's not considered an exposure for us, which is a good thing. And that's been, we have enough equipment right now for our use that has been able to keep us safe. As far as outside of that, like non-job related, we've had 2 cases of, family exposure to possible coronavirus. So we've had a couple days off for one part-time member at this point in time, but that's it for that. As far as staffing, if it were to get into the department, we run the 24/48 or the 24-hour shifts, I should say. So we should be fairly good. Hopefully it doesn't hit everybody at once. If it were to happen with that, we have had conversations countywide as far as mutual aid agreements and so forth, so that alternate departments in the county and even the surrounding counties can come and help out if needed.
Thank you. And do you have access to testing?
We do. We're in tier 2 in the state, and in the state of Wisconsin, tier 1 and tier 2 are kind of clumped together. So it's still done through their primary providers, but once they call in and go through the questionnaires with their primary doc, they will then be, as long as they let them know that they're a first responder firefighter, they'll have the opportunity for the testing.
Thank you.
Any other questions from the council? Seeing no further questions, thank you for the update.
Good night.
You too. Mr. Sayer.
Thanks, Dan. So last is Patrick Anderson from Fitrona EMS. I lost him. There we go. Patrick, you're muted.
Muted. Okay.
Yep, you're good.
But after waiting patiently all evening, you kicked me out of the meeting. Good evening, everyone. I don't have a big, beautiful project board. I'm kind of jealous of what Theron had in his background, like big old plans of stuff he was going to do. Similar to what Chief Coughlin and Chief Mahak were explaining there. So personnel-wise, we're very fortunate. I'm still up to 100% staff. We've had a couple of people with some, essentially we're going to call them flu-like symptoms. One of them actually did go in and get tested at some point. And this was over the last 4 weeks or so. So fairly early on in the process, he tested negative. The other person tested for flu. So again, very fortunate. We're still at 100% of staffing levels of at least our street medics. Myself and Deputy Chief Dostalik are still coming into work as much as we can. Probably two full days a week. I think we sit on teleconferences just like this, becoming very Zoom experts on life. So 2 days a week are full of those. We do have Michelle, who's our office manager, has been primarily working from home. What she can't do from home, essentially printing checks and signing them, myself and Jeff have actually picked that up in the station, essentially. We do have contingency plans. I've continued to work through those over the last couple of weeks on good case, bad case, worst case kind of scenarios on exactly what we can kind of lose as our workforce, adjusting schedules and still stay in business. The Department of Health, who essentially provides the oversight for EMS agencies, about a week ago, the governor signed a waiver. So there's some pretty significant waivers that were granted as far as staffing levels, and gives us actually a lot more options emergently, essentially, that we can do without actually having to go through the whole application process to change staffing levels. That is only granted through this state of emergency. So right now, that's the next 4 weeks. Hopefully, we don't have to get into that. As Chief Mahaka also said, we're working on a cross-credentialing kind of proposal with a couple of the paramedic agencies in Dane County to be really proactive. As he said, should the worst case scenario come in and take out half of our workforce, either from illness or family illness or in quarantine, we're actually able to staff our own trucks or assist in cross-credentialing and getting trucks to our neighboring services. So lots of plans in their place as well. Worked with our fire departments. We could actually go down to a single paramedic and a firefighter as a driver. That was part of the waiver process. So lots of options we've got out there, kind of based on the scenario we're presented with, but should be able to keep all 3 trucks in service and play with those as far as personnel goes. Hot topic in the news is, of course, the personal protective equipment. I'm going to consider ourselves really fortunate. We're actually sitting in a really good spot for personnel protective equipment. It was one of the, I don't know if it's an ironic thing or the masks, these N95 masks you hear about in the news, were predominantly used for tuberculosis patients. I've had cases of them sitting in the shelves. It's the same cases that have probably been in the 19 years I've been here, have probably been sitting in those shelves for 19 years. Who would have ever thought we would have needed this many N95 masks? So really fortunate for what we have. I think I heard it was Stephanie kind of did a shout out. So Verona Safety Supply donated a huge thousands of N95 masks to us in Dane County. So we kind of took our share of what we project we'll need for the next couple months, gave those to Dane County to redistribute. St. Mary's, SSM Health, and UW helped us with some gowns and some face shields. The Verona School District actually was able to donate some gloves and some masks. Yahara Bay Distillery was actually donated a couple cases of hand sanitizer, so a huge asset for us. The next request was we'd like it bourbon scented. The vodka, so it doesn't smell like anything but hand sanitizer, but it's been a phenomenal help for us. And then Chief Coughlin talked a little bit about last week. Orin Technologies, company there in Verona, started working with them last week on some larger scale kind of disinfectant I don't want to call it less toxic, but probably a little bit more health friendly with the dioxide based cleaners that we can actually put in some backpack sprayers. So do some large scale disinfecting of our ambulances, of our stations, equipment, clothing. So that's kind of actually been the latest thing we've been able to do here, just to make sure that we are safe as well from ourselves as well as our patients. Operationally wise, kind of mentioned 2 to 3 times a week, reaching out with Dane County Emergency Management, Dane County EMS chiefs to make sure that we're all doing what the Dane County Public Health is advising, who's doing primarily what the CDC is advising. So make sure we're best practices. Fortunately, in the last week or so, things have leveled off a little bit. The first couple of weeks before that, there was times that it felt like every hour, like the guidance changed to keep up with best practices. So we think we've kind of found a good place, a happy place. And you can kind of see that from the numbers, though they're going to go up. You've heard the peak is 2 weeks away. We're realizing that, but I truly believe we're doing what we're supposed to be doing and extending that plateau, keeping it lower to be able to deal with what we got. Chief Coughlin mentioned a couple weeks ago, we were actually doing it before the CDC, the governor mandated it. The 911 center is actually doing some screening. So there's a handful of questions, and those have actually changed over the last couple weeks as well. Simple things like, do you have a fever? Do you have a cough? That we don't call them COVID patients. We call them, they're EIDS, actually stands for emerging infectious diseases. So they're an EIDS positive patient. Doesn't mean they have COVID. It essentially means they have a fever, cough, and something. They're high risk is what they are, and that's regardless of the age. So we're actually notified of those on the way to the call. Our crews, we still treat every single patient, as you've heard in the news, right? It's community spread. We're treating every single patient like they have this, whether they're symptomatic or not. Really, it just is, are we going in with a full gown, mask, face shield, and a N95 mask? We are wearing a basic, at a minimum, a surgical mask on every patient contact, just because we don't know. Other chiefs had mentioned this as well, and we started doing this weeks ago, reducing the number of responders, asking police to just be in the area but not respond unless it's truly an emergent or we need their help. Doing this in both municipalities. They're kind of staying in the neighborhood for us. Very similar with fire, they're responding out to calls with us, but they're staying outside of the residence. Or if they have to, sending one person in, even with our own crews, if we can only send one person into a home and kind of assess what that need is, we're trying to reduce the number of people that we're even potentially exposing. Few adjustment in our patient care protocols, working closely, as I mentioned, with Dane County EMS, the UW Health System, the Emergency Education Center, that's our medical direction, our consortium, with a couple other paramedic providers in Dane County, have adjusted a couple of practices, essentially reducing, not ever compromising care, similar things to nebulizing medications to these patients with respiratory issues. It just starts to nebulize that infection as well. So reducing nebulized medications. Verona Pharmacy was another one, kind of a good shout out, has been phenomenal in working with us, getting medications to us at cost, versus going through our normal supply routes where either we can't get it or it's just really cost prohibitive and we're not able to we can't roll those costs over to patients. It's not going to happen. So he's been really phenomenal over there, getting us some changes in our protocols. I guess the last thing I would mention is, as we're kind of spooling up to the potential peak here, working with our area hospitals, another thing we've started to venture into with Dane County and a couple other paramedic agencies is actually interfacility transports. So that's actually something we're not licensed to do through the state of Wisconsin. We're kind of doing some investigation on how we do that. That was one of the waivers, as patients potentially will need to be moved from the hospital, will be discharged from the hospital, or transferred between hospitals in the area to open up beds or ICU beds. That's something we've kind of thrown our name in the hat of how can we assist with that, financially supported, as well as resources wise. So lots of kind of moving parts with all of this. That's kind of what I have in a nutshell.
Thank you for the update. Any questions for Chief Anderson? Seeing none. Thank you for the update.
Welcome.
It's Patrick.
Mr. Sayer?
Those are all the updates that I have. I think the only thing that I would just add is, and I think you've probably seen a lot of this online, but just go support your local businesses as much as you can. They are struggling immensely. You know, we've had layoffs in this, or furloughs in the city already. Our small businesses are struggling as well. So any opportunity anybody can make during this to help support those businesses is critically important at this point. So I'll just encourage everyone to do that as much as possible.
I completely agree.